first. Before our program begins, please pay attention so that you get to know where to run to in case of an emergency. Karibu.
Good morning, ladies and gentlemen. Good morning. Welcome to Imara Ole Sereni. My name is James. I would like to brief you shortly in the event of an emergency. And evacuation has been ordered. Where to go? All protocol observed. The room where we are is on first floor. That's level 1. And it is called a marble room. Today, we don't have any emergency, any drill, so we don't expect any interference. But in the event of emergency and the evacuation has been ordered, we shall use the 4 doors, the 5 doors you can see behind you, because you are facing this way. We have 1, 2, 3, 4, 5. We'll use the doors and follow the fire signs to the safe area. Our assembly points is first on the ground, outside the parking. That's where we'll all converge. We don't expect any emergency, but should there be, we shall vacate the room through the doors. Washrooms, instead of asking where are the washrooms, when you walk out from any door, you turn to the right. Then right, the washrooms, the gents and ladies are just with us here. Lunch will be served at level 3, that is Acacia Restaurants and Sky Lounge, according to the schedules and the programs that is running. Sky Lounge is on level 10, Acacia is level 3. In case of any medical attention, we have our clinic operating right now up to 5, and we also have the doctors on call. And I think the organizers have also the medical arrangements, which will give you the first aid through our clinic. Then thereafter, the arrangements will be made to ensure that your health is taken care of. In the event of a small fire in the room, and you are safe to put it off, we have the fire extinguishers at that far end, and another one at that far end. So in case of the fire, and it's any fire, and it is safe to do so, please use them. In other cities, people purport to be participants, but when you break for tea, for lunch, in other cities, not here, they grab your laptops. Know your neighbor. I'm not saying your neighbor is a thief. I am just saying know your neighbor, so that in case you go for lunch, for small gadgets, please make sure that you don't leave your items. And even when at the end of the session, please don't forget your gadgets, the laptops, and your phones. Otherwise, we shall organize. The Ole Sereni is under CCTV from end to end. We have the CCTV around, and in case of anything, we will be able to catch for those who attempt to interfere. Otherwise, you are safe in here, and I can guarantee you, because the government has also provided armed police taking care of us all. Thank you, and have a good session.
Thank you very much, James. Let's appreciate James for the security brief. I hope everyone paid attention. Thank you very much, ladies and gentlemen. Once again, let me apologize that we are starting late, but we'll try and catch up so that we are on time. Now, I'd like to welcome everyone to this Pan-African Conference on Environment, Pan-African Conference on Environment, Climate Change, and Health. The theme is on harnessing science, policy, and partnerships for environmental sustainability and climate health resilience. So before we start, I'll ask all of us to stand up for our national anthem and the East African anthem, which is a prayer. We'll take that as a prayer, and then we can start the program. Let's all be upstanding for the national anthems and the East African national anthem. Thank you. Seems that we are having a challenge. I can assure you that I'm not qualified to sing. I will rely on the DJ at the back to. Thank you. I'll also ask you to keep standing. This conference comes immediately after Kenya and Africa learnt of the death of one of its greatest sons of democracy, the Right Honorable Raila Amolo Odinga. Let's observe a moment of silence in honor of the man whose fruits of a relentless fight for democracy and freedom we enjoy today in Kenya.
Trip on a sailing ship, but when I reached Jamaica, I made a stop. But I'm sad to say I'm on my way. Won't be back for many a day. My heart is down, my head is spinning around. I had to leave a little girl in Kingston town. Sounds of laughter everywhere, and the dancing girls swing to and fro. I must declare my heart is there, though I've been from Maine to Mexico. But I'm sad to say I'm on my way. Won't be back for many a day. My heart is down, my head is spinning around. I had to leave a little girl in Kingston town.
Thank you. You can now take your seats. Thank you, everyone. My name is Dr. Mercy Korir. I'll be your MC through this opening ceremony program. I'm the CEO and editor-in-chief of Willow Health Media, which is a niche digital platform that covers health and health-related issues like climate change and its emerging concerns on health. Now, before this conference, I was just thinking about the issues and the conversations that we've had. Many a times people think climate change is something so distant that is not affecting us today. And the other day I was in a class, at a sustainability leadership class, and one of our classmates was giving us a story of where he lives. He's in Kitengela. For our visitors coming to Kenya, Kitengela is one of, well, not very dry, but we can consider it a dry area. So when he bought his land there to settle his family, he, apart from building his house, he planted trees in his compound. But when his other neighbors came in, they were clearing everything so that, they can have a beautiful house, put cabro, which is stone pavements and things like that. But when it's hot, then he has a microclimate, and all his neighbors, all their chicken and everything comes to his house to be sheltered. And this story for me reminds me of, the little things that we can do to influence climate either positively or negatively. And these environmental challenges, this story reminds me of the environmental challenges, such as the climate change and its effects, that these are no longer distant threats as we think about them, but they are active issues every day that undermine a clean and healthy environment, public health, food security, and economic stability. We here in the developing world, particularly in Africa, are disproportionately affected by climate. Yet, often we say we least contribute, but there's a way that we contribute to the effects of climate change and its impact on vulnerable populations. Kenya, like many other nations, face increased environmental disturbances, disease outbreaks. If you think about malaria, dengue, and other mosquito-borne diseases. And we also face many socioeconomic challenges that are linked to the rising temperatures, erratic rainfall, among others. This means, therefore, that there's an urgent need to tap and translate local and global scientific evidence to inform policy, development, foster knowledge, knowledge exchange, and strengthen multi-sectoral collaboration in policy implementation. And that's why, ladies and gentlemen, we are here to translate science into policy. And today we'll get to hear from different policymakers, from different people in science throughout this week. And at the end of the day, we have to take all of the things that we learn and translate it into policy and translate it into tangible things and activities that we are able to do for us to either mitigate or adapt to the emerging changes of climate change and its effects. Now, I'm going to call in our next session moderator. If you need translation, we have this gadget on your seats. You can raise your hand and you'll be assisted if you need the translation. So allow me to welcome our next session moderator, who will welcome the co-conveners to address this opening, Dr. Keegan Bartilol, who's the Acting Director at the Directorate of Health Sector Coordination and Research at the Ministry of Health. Let's give him a warm round of applause as Dr. Bartilol comes on stage.
Thank you, Mercy. Good morning, everybody. I think I'll start by welcoming you to Kenya, those who are from outside, to the city of Nairobi, which, as we know, is the only city with a park within itself. So I want to welcome you all for this important Pan-African conference on environment, climate change, and health, where we're talking about science into policy.
Sorry for that. I forgot to welcome the chairs of the session for the climate setting before we welcome Dr. Bartilol. So I'll ask the Dr. to just have a seat for 5 minutes. Dr. Charles Lange to come and give the climate setting. My apologies for that. Dr. Lange is from NEMA.
Thank you very much. Thank you very much, session moderator. Allow me to start by recognizing the chief guests who has arrived this far. I want to recognize the chairs of the board of two key institutions who have been part of these convening institutions. I want to recognize the chairman of the board of management of NEMA, Emilio Mugo, who is with us today, the chairman of KEMRI, who is with us today here, Abdullahi, I want to recognize also my Director General, Dr. Mamo B. Mamo, who is the DG for NEMA, who is with us here today. I also want to recognize the Director of the Board of Management in NEMA, Dr. Lois Kipkore. I want to recognize our former DG from NEMA, who is also going to be a panelist in one of the most exciting sessions. Professor Micheka, who is with us today. I have also recognized, apologies, I know the guests are coming slowly by slowly. Another director of Board of Management for NEMA, Dr. Mos Adama, who is with us. I want also to recognize CEOs of the organizations that have been able to join us today here at this monumental occasion where we are opening the Pan-African Conference on Environment, Climate Change, and Health today here. Ladies and gentlemen, as I said, as has been said, my names are Charles Lange. I have and I'm still the co-chair of this very important conference on Pan-African Conference on Environment and Climate Change and Health. Formerly, I work for the National Environment Management Authority as the acting director for environmental services that carries the research, environmental planning, it carries awareness, it carries programs, it carries also ecosystem management. And so, as the co-chair of this conference, apologies for that interruption, as the co-chair of this conference we are beginning today, I would like to say that today is running through this week is indeed a unique and momentous occasion for all of us who are seated here today. I call it a unique and momentous occasion largely because from my best recollections, and I say my best recollection, hardly can I recall a conference that previously brought together the three giants, and I call them the three giants because that is environment, climate change, and health professionals in a scope and dimension provided in the scope of this conference. Yet, for a long time, these three giants, they have been waiting for each other to start a discussion on how they can start to work together. So ladies and gentlemen, I can recall even the beginning of these formations of this conference. Initially, the environment professionals were sitting alone. And I remember the DG was telling me, we want a national environment conference. And I went for the professionals in the environment sector. But then along the way, then we realized along the same time, then there were other conferences that were touching on climate and health. And they were almost touching on the same thematic areas. And so fortunately, and incidentally and fortunately, we trampled on each other and we discussed and found that for us to move the spirit of our government, particularly in Kenya, where we talk about one government approach, a whole of society approach, we needed to try and see how we can come together and bring the three giants together and have a Pan-African, because Pan-African is a special word, where we can now bring this and try to find common solutions that really we can address environment, climate change, and health together. Science has given us that indeed there is a lot of interconnectedness between environment, climate change, and health. And they have been waiting for one another and so after that, then we had a series of discussion, comprehensive and defensive discussions on how the conference title should be. Because the health were feeling that then they needed to start with health. The conference said health, and then environment comes to the end. And we were thinking that environment drives virtually everything. And so I want to sincerely thank the colleagues who really we persuaded and agreed that indeed environment is the foundation of all these, of many of the challenges, and so including health. And so we finally arrived at Pan-African Conference on Environment, Climate Change, and Health. I want to sincerely thank the leadership of the institutions that are convening this conference for also agreeing to bring this conference to make it environment, climate change, and health. It has never been easy for these professionals to agree on very easily. And so then the journey started from mid of this year, and then we come up with a number of 9 tracks that we are going to be treated. You've seen the website, the number of sub-themes that are going to be presented here. We fortunately got over 400 very top-notch science abstracts that were presented, and it was very difficult. It was very difficult to identify which of these over 400 abstracts were going to be selected for oral presentation and poster presentations. So I want to assure you then the committee did its best, the scientific committee, to select the best with the homegrown solutions that we can be able to, when you're participating here, to take home and try to test those homegrown solutions. And so I want to sincerely take the opportunity to sincerely thank the organizing committee, which was composed of teams from Kenya and almost across Africa, because we are working with ARIN and Chance Network, which have the network across Africa. So most of our meetings were virtual, but we almost agreed in most of the things. So as the moderator said, we have one of the best progressive theme for this conference. If I read the theme again, just to remind colleagues about we are here to drive a conference on harnessing science, policy, partnership for environmental sustainability, climate health resilience throughout this week. As I said, we have lined some of the best presentations throughout this week. So please prepare yourselves to interact with the presentations. These are the opportunities for networking, so that in the coming times you can find opportunities for further project development, further networking, for moving the African agenda under the Pan-African Environment, Climate Change, and Health Conference forward. So I know members of the scientific committee are around, and we wanted to have, when the chief guests arrive, to just recognize them. But since our chief guests have not yet arrived, I will stop it at that, and sincerely thank once again all of you for finding time to come to this conference so that we can move this Pan-African environment, climate change, and health agenda forward together. Thank you very much, and Asanteni. Thank you.
Thank you very much, Dr. Lange from NEMA. Thank you for those opening remarks. Now let me welcome back to stage Dr. Bartilol as the next session chair to welcome the co-conveners for the address. Let's welcome him once again.
Thank you very much, Mercy, and thank you for that remarks from NEMA. I think my work is quite straightforward. Mine is to call the co-conveners for their addresses. I'll start with Dr. Gloria Maimela, who's the Deputy CEO, Foundation for Professional Services, and also the chair for the Chance Network. Karibu. Just give her a round of applause as she comes up.
Good morning, delegates. Good morning, distinguished guests, esteemed ministers, fellow scientists, policymakers, developmental partners, community leaders, and friends of Africa. Habari ya asubuhi. Asante. So I've been asked to give a speech on behalf of the Chance Network. So it's a privilege and a deep personal honor to welcome you to the Pan-African Conference on Environment, Climate Change and Health, Science to Policy. Here in Nairobi, the green heart of Africa and a symbol of our continent's resilience and innovation. I stand here before you today representing the Climate and Health Africa Network for Collaboration and Engagement, the Chance Network. On behalf of the Chance, and I stand here on behalf of the Chance, the steering committee of the Chance Network, our co-conveners, the African Research and Impact Network, ARIN, the Ministry of Health, Ministry of Environment, Climate Change and Forestry, on behalf of NEMA, KEMRI, and AMREF. And I extend my sincere gratitude to all of you delegates for answering this call to action. Across our continent, we are witnessing profound transformation, not the kind that is of our own making, but the kind that we must now respond to with urgency and with unity. African communities stand on the front lines of climate disruption, experiencing drought, floods, rising temperatures, and disease outbreaks. We know the malaria, dengue, and cholera that have put our health systems under strain and threaten our hard-won development gains. 2024, which was last year, was among the warmest on record, with temperatures nearly 1 degree above the long-term average. The heat has not only scorched our soils and crops, it has tested the endurance of our healthcare workers, it has displaced our families, and challenged the very system that protects us. Yet amid this challenge, Africa is also showing the world what leadership looks like, and this conference is a testament to that. The Chance Network was established in 2021 and aims to advance networking, research, learning, policy and financing for climate change and health in Africa. Our mission is to provide an enabling environment to engage a diversity of stakeholders to address health and climate priorities in Africa. Through our various knowledge exchange platforms, we bring together the scientists, the policymakers, civil society organizations, and other climate and health communities together to synthesize the latest evidence, to share knowledge and best practices across the African continent, making sure no one is left behind. Chance boasts a membership of over 400 members across the southern, eastern, Western and Central Africa. We are proud to co-convene our fourth Progressive Conference, bringing forth learnings from previous conferences that we held in South Africa, in Botswana, and last year in Zimbabwe as part of CHAC. In this conference, we are grateful to our co-conveners, including strategic alliances with the WHO Afro, the African CDC, and the UNFCCC community, ensuring a coherent, unified voice that will move Africa forward. Delegates, this conference would not have been possible without the generous sponsorship from the Wellcome Trust. And I wish to take this opportunity to thank Dr. Alan Dengo, Ms. Modi Motsama, Madeleine, and Yolisa. Thank you very much for believing and investing in our vision. A heartfelt thank you to also our generous sponsors that include the Rockefeller Foundation, TNO, LEAPS, IDRC, APHRC, and many, many others. We thank you because this would not have been possible without your sponsorship. Delegates, our purpose is clear: to translate research into policies and best practices backed by financing and climate justice that saves the lives and livelihoods. In this conference, we will deliberate on how to strengthen the links between the environment, climate, and health, and how to finance adaptation equitably, and how to ensure that the solutions we champion are inclusive, reaching women, youth, indigenous communities, and those most affected by environmental change. We are also intentional about making sure that this is not just another talk show, delegates. Together with our partners, we have post-conferencing activities that will ensure that our commitments here do not end with closing remarks, but live on as actionable programs, measurable indicators, and continental collaboration. Delegates, the African story must shift from one of vulnerability to one of agency, innovation, and leadership. We have the knowledge. What we now require is the political will, the financing mechanisms, and the partnerships to act decisively. As we engage over the coming days, let us anchor our work on the three principles: equity, evidence for informed policy, and empowerment. Allow me to close with the words of one of Africa's greatest daughters, Professor Wangari Maathai, who reminded us, it's the little things citizens do that will make the greatest difference. My little things is planting trees. May each of us find our own little thing during this conference, whether it be building data systems, crafting inclusive policies, or mentoring the next generation of African scientists. Together, our collective action can nurture a climate-resilient, health-secure Africa. I thank you all for being here, and I wish you a fruitful and transformative conference. Welcome to Nairobi, and welcome to a new chapter of African leadership in science, policy, and resilience. Thank you very much.
Thank you very much. Let's give another round of applause. Thank you very much. Now I want to call in the next co-convener, Johannes Atella, who's the Executive Director of ARIN, Africa Research and Impact Network. Karibu. Let's give him a round of applause as he comes to encourage him.
Thank you very much, Chair. Distinguished guests, ladies and gentlemen, allow me to recognize our dignitaries in the room. In absentia, our ministers who will be joining us later, the Minister for Health and the Minister for Environment. Amidst us, we have the board chairs of NEMA, the National Environment Management Authority, the board chair of KEMRI, the Director General NEMA, my friend Mammo, and of course, my great mentor, former Director NEMA, Professor Ratemo Micheka, and all dignitaries and guests in the room. Good morning. My name is Johannes Atella, as you have heard. I am the director of the Africa Research and Impact Network. Allow me first to welcome all of you to this important conversation. Ladies and gentlemen, we are here, as I've said, to really talk about an important issue in our life today. We are here not just to gather and greet, but to collectively find solutions that can help us to confront the complex issue around the impacts of climate change on health. The Africa Research and Impact Network, ladies and gentlemen, is a pioneering research and policy network that unite leading scholars across Africa. We bring together about 200 researchers and policymakers across 36 African countries. We have two main mandates. Number one is to consolidate evidence on what works and what does not work. And when I talk about that, I hope you understand that already we have a lot of plans and ideas, even when it comes to climate and health, or environment, climate change and health. But do we know what can work on the ground? That is one of the things that makes ARIN not to sleep. How can we make things to work from the boardroom, from the decisions, and to be actionable on the ground? Number two, we are a leading convening network. We bring together many stakeholders on board. And these stakeholders, we work with them to showcase some of the innovative practices when it comes to science and policy and actions. Currently, ladies and gentlemen, the ARIN network, we are leading a platform called the Consultative Platform on Climate Change and Health for Africa. This platform is focused on building and bringing people together because we understand that the issues around climate change and health and environment are not a one-sector thing. They are multi-sectoral, and the only way we can tackle them is by talking together, by learning from each other. So we lead in convening a number of initiatives to ensure that we learn from them and we move the process forward. Ladies and gentlemen, the impacts of climate change on health has been documented in many ways. I don't need to mention them. The only thing I want to emphasize on this is that these impacts are drawn or mediated by several sectors. The impacts are not just about the health sector. It's about the agriculture sector, how climate change impacts on the agriculture sector to create food shortage and malnutrition that affects the health of young people, the children, and even adults. It's about energy, how the issues of energy and clean cooking mechanisms basically results into indoor air pollution and causes a lot of deaths in Africa and in Kenya, of course. It is about the water sector. And therefore, this conference is very critical, simply because it pays attention to this multifaceted complexity that we see in the fight against the impacts of climate change on health. Ladies and gentlemen, I want to say that the efforts to address these impacts have taken a transformative policy approach in the last few years. The landscape of climate change and health policies is currently and constantly evolving, marked by critical junctures that navigate collective action at the various levels. At the Conference of Parties 26, COP26, health gained a significant traction within the climate agenda with the launch of the COP26 health initiatives and the Africa or the Alliance for Transformative Action on Climate and Health. That's the ATTACH, which was led by the World Health Organization. The ATTACH focuses on encouraging countries to put in place measures that build resilience of health systems and achieve low-carbon healthcare. The paragraph 9 of the recently launched Global Goal on Adaptation basically targets health as one of the sectors that countries are supposed to be reporting on when it comes to adaptation. So this shows you that health is already at the center of climate action and decisions at that global level. The funding environment as well, ladies and gentlemen, has been limited in the recent past. But with time, we see several international funders who are increasing their efforts to fund Southern-led initiatives. This is evidenced by the efforts from the funders like Wellcome, who are supporting this conference. We want to thank them very much. The Rockefeller Foundation, also supporting this conference. I want to thank them very much. The IDRC, the International Development Research Center of the Canadian government, I also want to thank them very much. And many other funders who are coming together to support Africa. Now, ladies and gentlemen, with this political goodwill and funding opportunities, how do we turn these ambitions into real actions that change and safeguards the resilience of our people, systems, attract adequate investments, and support necessary capacity to transform words into action? How do we turn the political goodwill into real-time action? There is an urgent need for science to support the translation of the policy agendas into bankable actions. Bankable actions that are anchored on multi-stakeholder and multi-sectoral frameworks. And this is the conversation that we are having in this conference today. I want to say that for the first time, this conference is bringing together some of the sectors that have been yearning to work together, the environment sector, the health sector, and they are sitting on the table to agree to work together to basically move the process forward. As a REAL network, we are committed to working together with all the stakeholders to champion a cause that will push decisions out of boardrooms. And I repeat, we need to push decisions out of boardrooms. We are here today. There will be resolutions. There is going to be big addresses and good intentions. But how do we move those decisions and declarations to the ground? I want to conclude by saying, as the famous quote of our recently departed hero, the Right Honorable Prime Minister Raila Amolo Odinga, may his soul rest in peace. He said, regardless of what you hear, the successes and failures you see, I want to tell you that it still pays to work hard and play by the rules. Success is a lie when founded on shortcuts and deals negotiated in smoke-scaled rooms. Ladies and gentlemen, with those very few remarks, I want to leave you and say, may God rest our former Prime Minister's soul in peace, and may God help us that his spirit of hard work, democracy, and the rule of law, and the focus to be able to confront any complexity can guide us in this conference and enable us to deliver solutions that are going to be transformative in our continent and in our country, Kenya. I thank you very much.
Thank you very much. Give him another round of applause. He's actually told us the importance of this conference and how we must network and work together. Finally, I want to invite Dr. Martin Mushangi from AMREF Africa. Martin Mushangi is the Director of Population Health and Environment. Karibu, give him a round of applause as he comes.
Colleagues, friends, dignitaries, all protocols observed. Good morning. Yeah, so once again, my name is Dr. Martin Mushangi, and I work for AMREF Health Africa. AMREF Health Africa is an organization which prides itself with a vision of creating lasting health change in Africa. We do this by working with communities. We work very closely with the government. We are not an organization which is about 60 years ago, which was established like 60 years ago. And we have not left that vision and mission. More specifically, we try to make sure that anything that would come between the health of individuals is arrested at the household level. And you know, climate change is the greatest disruptor. We have seen this here in Kenya when we had droughts. We have seen this here in Kenya when we had floods and all that. And that narrative spreads all across the world. So that said, AMREF Health Africa has been at the center of trying to elevate the voice of the health sector in the climate space. And we have done this pragmatically in different forums. We ran a process which came up with the first common position in Africa. We went all the way to COP28, there was the health declaration and all those nice things happening. But then there's a big question, and that is what brings us together with the Chance Network, together with Arlene. And the question was, how do we consolidate our efforts? How do we become better? How do we move forward in a more synchronized way? And surprisingly, we also met like-minded entities. That is the Ministry of Environment, and of course, with the leadership of the government, that is the Ministry of Health and the Ministry of Environment. And I am so pleased today to see that the journey, which was like divergent, is coming to be a convergent journey. So this is a big opportunity, and especially when you have government leadership and ownership of the processes taking precedence. So, as we get to the conversations here, there are a few things that we need to keep in mind. The first element is, it is so difficult to convince anyone that there is a case for investment, there is a case for policy without evidence and data. We have scientists in this room. Let this be an opportunity to bring forward that science which can then raise the impetus of the policymakers to start absorbing that. Then the second thing is, it is the national policies and strategies that normally give direction into the investments and plans. For the policymakers here, the civil society organizations, and all of us who are here, let us take this opportunity to listen to the nuances which can help us to make fitful policies moving forward. And where we have them, let us try to see how we can integrate the actions moving forward. And lastly, what matters most is what is happening in the communities. It's those lives that you touch. It is those children and women who have been spoken minutes ago, those who are suffering. Once we touch them, that's when we can count ourselves as winners. Now, I'll end by saying this. Leadership is everything. And the other day I was told that success is determined by 50% of leadership, and 50%, the other 50% of the success is determined by teamwork. So now that we are here, now that we are talking about a whole initiative that we are building forward, it is Africa with us here. It is us to think about how we can make sure that instead of having, small initiatives here and there, we offer leadership, that servant leadership that is going to steer this continent, this country, beginning from ourselves here. I am from Kenya, beginning with our country. Let's see how we can coordinate ourselves better. Let's see how we can support our governments. Let's see how we can support each other to do better investment plans and to build a better future. I thank you so much, and karibuni sana.
Thank you very much. Let's give him another round of applause. I want to thank the co-conveners, the ones who have actually made sure that we are all here. And as they have said, we really must work together, science to policy, policy to action. That's what we are talking about. With those few remarks, I'll hand it over back to Mercy to continue. Thank you.
Thank you, Dr. Keegan Bartilo. Let's appreciate him for moderating the session. Now we'll move swiftly to our next session where we want to hear from our sponsors, and Gloria was able to highlight some of our sponsors, who they were, and we appreciate them for making this particular conference a success. And for this session, for the sponsorship address, I'd like to welcome Dr. Martin Bundi, who's the Acting Director for Research and Capacity Building at KEMRI, the Kenya Medical Research Institute. Let's welcome Dr. Bundi so that he can lead the next session. Karibu sana, Daktari. Let's appreciate him. Only this corner is appreciating the speakers. This other side, thank you.
Thank you very much, Dr. Mercy Korir. Distinguished delegates, conference organizers, colleagues, friends, all protocols observed. Good morning, everyone. Good morning once again. So as introduced, my name is Martin Bundi. I work for the Kenya Medical Research Institute as the Acting Director, Research Capacity Building, and it is a great honor to moderate this special session where we are going to recognize our gold sponsors, and these are organizations whose unwavering support, partnership have made this Pan-African conference possible. Through the investment in science, innovation, and evidence-based policy, these partners exemplify how collaboration across research, philanthropy, and implementation can drive environmental sustainability and climate health resilience across the African continent. To begin with, Help me appreciate and welcome Ms. Yvette Fleming from TNO. And TNO stands for the Netherlands Organization for Applied Scientific Research and is a global leader in applied research, innovation, advancing practical solutions for climate, energy, and health systems worldwide. Welcome, Ms. Fleming, and give you 3 minutes to address us. Karibu.
Good morning, everybody. With due respect to all previous acknowledged protocols, I'm excited and a little bit humbled to introduce to you TNO. TNO is the Netherlands Organization for Applied Science. A few facts. It's a research institute, not for profit, founded by law in 1932. 90 plus years in existence. What we do, some facts, 5,000 colleagues, all science-based. We have a turnover of about 700 million euros, half of it being state funding, and 30% of that is international. We have a unique knowledge base across different units, and I'll mention them: defense, safety and security, health and work, which this one comes into play, ICT, strategy and policy, high-tech industry, mobility, built and environment, and energy material transition. We hold 937 patents. We have 22 locations in the Netherlands. Out of 6 of them have lab facilities. And we operate in the innovation ecosystem in the Netherlands. The triple helix, we call that. Government, industry, knowledge institutes, so knowledge institutes, university, and in between that, that's where we are, TNO, a research and technology organization. We also say we cross the valley of death, meaning universities operate in a very low TRL level, technical readiness level. The industry operates at a high technical readiness level, 10 to 12, so really entering into the market. And we actually cross the bridge between universities and the market. And the market sounds a little bit maybe strange to all of you because maybe you're policymakers, government, but market for us is also a policy, you know, something that you bring to the people, the customers, etc. I'm here with 3 colleagues who have over 30 years of experience in climate and air quality in the Netherlands and in Europe. And maybe you guys can stand up. On this conference, and this is not the first one that we engaged in conferences with you, we engaged in the CASH conference 3 years ago. I went to Machakos with 2 other colleagues, also for a climate conference. We had a Kenyan delegation visiting us in the Netherlands, including your PS, I think a year ago. So it's been a continuous support to the Kenyan ecosystem when it comes to climate and health. We will be presenting and speaking during the plenary on Thursday. We'll be sharing our ambition for sustainable atmospheric monitoring services with ecosystem partners in Kenya and elsewhere in Africa. We will be having a workshop also on Thursday in the afternoon where we will show and share. It's a co-organized workshop with Amref Health Africa and with the University of Nairobi and supporting the Ministry of Health in doing a VNA assessment with a more quantitative base. So if you're interested in that, please come and join that session. And we have a booth outside where we also will share and showcase a model that we run. It's based on Eurus Lotus, which is a model that we own and we use in the modeling, atmospheric modeling in Europe. We built one that is also powered, so energy powered, and that can run in Africa. And so most welcome to see how that works. And foremost, I'm looking forward to engage, start new collaborations about important innovations and technologies in support of a more resilient health Systems Africa. So really looking forward to engage with all of you. And indeed, it's about research to policy, but also policy to action. And that's where action is, for me, the market, right? We translate everything into something that can be taken up by, whether it's a government, whether it's a community, whether it's academia for further research, or it is the private sector. So all of them are, for me, the market. Thank you very much. I'm looking forward to a very inspiring and engaging conference. Thank you.
Thank you very much, Ms. Fleming. A round of applause to her. And thank you for sticking to the 3 minutes. Next, ladies and gentlemen, help me welcome Ms. Gerishom Gimayo, representing the Rockefeller Foundation, a long-standing champion for equitable health and climate solutions through science, policy, and innovation. Welcome, Dr. Gimayo. Karibu.
Good morning, ladies and gentlemen. My name is Gerishom Gimayo from the Africa Regional Office of the Rockefeller Foundation. It's an honor to be here today for this important convening on environment, climate, and health. I want to thank all the partners, beginning with the co-conveners, the Ministry of Health and Environment, as well as the other partners who have been mentioned for hosting this important meeting and for hosting it here in Nairobi. At the Rockefeller Foundation, we are proud that much of our work over our 100-year history has taken place in Africa. Indeed, our Africa Regional Office first opened here in Nairobi in 1966. And today, over 1/3 of our funding is invested in the African continent. The foundation has invested in building institutions of public health and has supported on programs spanning HIV, nutrition, vaccination, and most recently the COVID-19 pandemic, and now the climate crisis response. This legacy is not just history, it is the foundation on which we continue to build our work. And yet, this progress is now challenged as much of the progress on global health as we move into a new era. Climate change is reshaping the health landscape across the continent. We have all seen and felt the effects of our changing climate, unpredictable weather events bringing both droughts and floods, outbreaks of cholera, malaria, and yellow fever becoming more frequent, and warmer temperatures increasing risks of heat stress, malnutrition, and other heat-related illnesses. At the same time, we have seen significant shifts in global health. The sudden reductions in aid, evolving global priorities, and reconfiguration of traditional financing have left many African health systems exposed precisely when resilience is needed most. Yet, there is reason for hope. Science, innovation, and collaboration, as we will see throughout this week, are driving a new era of African leadership, one that builds health systems that are not only resilient, but also sovereign and self-sufficient. Across the continent, countries are taking the lead, from Senegal's work on heat resilience, to Kenya's efforts to address air pollution, to partnerships across Southern Africa tackling the devastating health impacts of cyclones and flooding, and their related health challenges. Similarly, Africa is helping redefine the global health architecture, one grounded in national priorities, country ownership, and equitable partnerships. This is the essence of the Accra Reset and various health financing agenda, of which our host country here, Kenya, is a strong champion and a signatory to. These are all important steps, and we must use this momentum to accelerate progress, mobilize resources, and advance our priorities as a continent. Whether we succeed is up to all of us here today, and at the Rockefeller Foundation, we look forward to our continued partnership with Africa to build a healthy, climate-resilient future of tomorrow. Thank you so much.
Dr. Gimayo, Rockefeller Foundation, thank you very much. Moving on swiftly to our third address, which will be from Dr. Rose Oronje, Dr. Rose Oronje is from LIPS Kenya, whose work continues to strengthen evidence-informed policy making and amplifying the African voices in global climate and health dialogues. Karibu sana, Dr. Oronje, to address us.
Good morning, ladies and gentlemen. I would like to stand on existing protocols. As noted, I'm Dr. Rose Oronje. I'm Deputy Executive Director at the African Institute for Development Policy, AFIDEP. But I speak this morning on behalf of the Africa LIPS Partnership, and LIPS stands for Learning Together to Advance Evidence and Equity in Policy Making to Achieve SDGs in Africa. And it's really an honor for us to be here this morning and to be one of the sponsors of this conference as the LIPS Partnership, because the focus of the conference on science to policy, and particularly science to policy on operationalizing the linkages between environment, climate change, and health, are central and align very well with what the LIPS Partnership is working on the African continent. The Africa LIPS is a partnership between evidence organizations, indeed leading evidence organizations across the African continent that are working to strengthen sustained use of evidence in decision making. We all know that to make key decisions, to make right investments, and also to implement programs that really impact people, you need data, you need evidence. And these organizations came together to address some of the persisting challenges around evidence use. One of them is just access to practical evidence that governments need to make decisions. The other one is weak capacities at individual level, at institutional level, that continue to hinder the sustained use of evidence in decision making. And so as the LIPS Partnership, we came together to speak and implement activities that address these challenges. And some of the activities we are implementing touch on the area of evidence to policy training for researchers, for technocrats within government agencies, as well as for knowledge brokers to sustain the capacities they need on translation of evidence, packaging of this evidence, synthesis of this evidence that governments need for decision making. The other thing that we do, apart from training, we also look at strengthening institutional structures, much of what we call as institutionalizing evidence use in government decisions. And here we are looking at structures that enable agencies within the academia, within governments, to sustain production, translation, and use of evidence in decision making. And the final one is improving access to evidence through establishing services like rapid evidence provision for governments when they need them, but also providing digital databases that enable governments to ask questions and speak and get results on the spot based on the evidence databases that we are creating through digital platforms. The focus of these initiatives, of course, we would have loved to work on every other aspect of development, but we work mainly in the area of health, we work mainly in the area of reproductive health, and we work mainly in the area of environment and climate change. That is where we have focused these efforts, and of course, that is the reason why we are here this morning to be part of this conference. The LIPS Partnership is implemented by 3 multi-institutional hubs, working together with other institutions as well as with governments across the region. And I just want to mention those 3 institutions: the African Institute for Development Policy, AFIDEP, which I'm part of, and I have colleagues around who can wave. We also have the Center for Rapid Evidence Synthesis, ECAS, based in Uganda, but implementing work in Southern Africa and East Africa. If you're around, you can wave. And I would also like to recognize the Africa Center for Equitable Development Asset, based in Benin, but leading work across the Francophone West African region around these areas that I've talked about. We're excited to be here. We have some sessions happening tomorrow, Wednesday, and on the final day, but we are also looking to really interact and share some of the things that we are doing to advance the theme of this conference. The LIPS Partnership is funded by the IDRC, by the Hewlett Foundation and the Bosch Foundation, and we are really grateful for these partners who are supporting us and working with us to drive the work that we have going on around the region. Really want to thank you and looking forward to the conversations today. Thank you.
Thank you very much, Dr. Oronje. Moving on swiftly, ladies and gentlemen, allow me also to welcome on stage Mr. Matthew Black from Unitate. Mr. Matthew, welcome to address us.
Thank you very much. It's always interesting to come on stage in events like this and tell you that I am black, but my name's Matthew Black. I'm the Country Partnerships Manager for UNITAID. UNITAID is an international institution housed in Geneva, housed under the World Health Organization, and established in 2006. So we have been working primarily on equitable access to innovative health products, and throughout our lifespan, that's initially been mainly focused on HIV, TB, and malaria, but has more recently moved into areas such as maternal child health, access to oxygen, and as has been realized by very many people, the nexus between climate and health has become increasingly more important. And we as an organization have recognized that we don't just need innovative health products, and we don't just need cheaper and more effective health products, but we need climate smart health products as well. So UNITAID is proud and happy to have moved into the sphere of climate and health, and we have done that in terms of, we're an onward granting organization, so we've done that in terms of getting our grantees to move towards more climate and health work, and we are developing our own program for launching calls for proposals for climate-specific work around both adaptation and mitigation. So my colleague, Julien Puy, who's the team lead on climate and health, unfortunately couldn't be here, but I will be standing in for him on one of the sessions on Thursday, where I'll talk a bit more about some of our work and can let people know a bit more about what it is we do and how we can form new partnerships and engage with others. So I'm very pleased to be sponsoring this event, very pleased to be here. Asante sana kwa watu wote, and tutaonana tena. Asante.
Thank you very much, Black. Indeed, your Swahili is perfect. Maybe that's why they call you Black. But thank you so much for that. Good, good. Yeah, so finally, ladies and gentlemen, we have Dr. Alan Dangur. Alan Dangur is a Director, Climate and Health at Wellcome UK, one of the world's leading research funders, driving a global agenda to tackle climate change as the greatest health threat of our time. So, ladies and gentlemen, help me welcome Dr. Dangur to come and give his remarks.
Wonderful. Thank you very much. I'm absolutely delighted to be here today. Thank you. Thank you to the sponsors. Thank you to the organizers. It's wonderful. So I do have some slides. I thought I would be the first person to show slides today, but if they don't come up, don't worry. I'm really, really pleased to be here, and I would like to also acknowledge my colleague Modi Muatswama, who's Kenyan, who sits in our team. She's in London this week chairing a committee, so she couldn't come. But I'm really thrilled to be here, and I'm here with two colleagues, Madeline Thompson and Yelisa over there, so they will wave. There we go. So do go, and any difficult questions, ask them. Don't ask me. Ask any technical or difficult questions, they're the people. So I just want to talk about what Wellcome Trust does. Wellcome is a global funder. We seek to solve the urgent challenges facing everyone everywhere. We focus on, we try to work on, we are known as being a funder of science, fundamental basic biology, and we continue to do that at scale. We have an enormous program on discovery science, cell biology, immunology, neuroscience, those sorts of things that are core to understanding health, the basics understandings. But we also now have a new strategy which is related to solutions. The solutions we urgently need, we drive the science into those solutions and then the policy impact. And those solution areas are mental health, trying to solve the three most critical mental health challenges, depression, psychosis, and anxiety. Infectious diseases, Wellcome is known for its work on infectious diseases, and there we're trying to deliver new vaccines, new treatments for some of the most pressing infectious disease challenges, especially in low and middle income countries. And then thirdly, the area that I lead, which is on climate and health. And in climate and health, what we're trying to do is, as we've heard today, really bring people together. I loved that comment this morning from Charles Lange, the three giants have been waiting for each other. Well, now absolutely is the moment to bring these three giants together: environment, climate, and health. Our health is entirely predicated on the health of the climate and the health of the environment. And we must see these fields as one now working together. So we are really delighted to be leading a massive effort on evidence generation at the intersection of climate change and health. Our mission is to put health at the heart of climate action. We recognize that in the future, all of our lives are going to be shaped by climate change, and all of our lives are going to be shaped by the policies which are there to address climate change. So by putting health into those policies, we believe that those policies will be fairer, will act with more urgency, and will be more transformative. And that's exactly what we need. So what do? We have three primary goals. The first goal is to build an ecosystem of researchers and a community of researchers and support the multilateral organizations that are really struggling at this time to continue their work. So, for example, we support the World Health Organization, the World Meteorological Organization, the United Nations Framework Convention on Climate Change. We support these organizations to really build that multilateral platform on which to build science. We also convene the funders. So we talk with all of our peer philanthropies like the Rockefeller Foundation and others to bring together all of the funders so we can work with an aligned purpose to drive change. We then want to advance science. So clearly many of you are scientists. I'm sure lots of you work on heat, others will work on infectious diseases, some of you may work on mitigation and adaptation. All of these things we work on together. And we're trying to advance science in a few areas. So really at the cutting edge of science, bringing together these communities of science, climate science, public health, infectious diseases, physiology, biology, bringing them together to advance science, not only so that we can understand the impacts of climate change on health, but so that we can deliver those solutions. And then, of course, I'm a former academic. I was a professor at the London School of Hygiene and Tropical Medicine for 20 years. I've written loads of papers, nobody's ever read them, and they sit there in the journals doing nothing. So we're not interested in that. We are interested in driving change and having influence and having an impact. So we are asking our grantees, don't just tell me you're going to write a nice paper. Do something with it. Actually do something with it. And so we are determined that our grantees should think about how they can use their science to drive that change, to drive the policy changes that they want to see, to influence the policymakers, to influence stakeholders, to influence the private sector, to influence the courts. You'll have seen the International Court of Justice advisory opinion earlier this year on the role of states with regards to climate change. There was a huge amount of health evidence in those advisory opinions, and much of that health evidence was funded by Wellcome. So using that evidence to drive the change, to drive the litigation actions, to drive what we urgently need to see. So that's what we're trying to achieve. I would have shown you a map of the evidence base. That evidence base is horribly skewed. Most of the evidence base on climate change and health is in Northern Europe, North America, and parts of Asia. If you looked at the map, you would see that most of Africa is completely empty. There is no evidence in most of Africa. You are going to change that. Yeah? Because it's essential that we have evidence from the countries that are most affected, driven and delivered by those people and those researchers who are based here, so that you you can shape policy, so that you can speak to your policymakers, so that you can drive the change. It's absolutely critical. We are here to support you to do that. This convening and Gloria's work and all of the teams who've brought this together is exactly an example of what we're trying to achieve through supporting the climate and health agenda. I'm absolutely delighted to be here with you this week. Thank you very much again for inviting me to speak, and I'm sure it's going to be a brilliant conference. Thank you very much.
Thank you so much, Dr. Alan Dangur. Apologies, your slides didn't come up, but that was comprehensively done. We can acknowledge that and speaking from the heart. Thank you so much for that. Yeah, so I'm guided. Last but not least, we have also Dr. Sam Oti. Sam Oti is from IDRC, International Development Research Corporation. So welcome, Dr. Sam, to address us.
Good morning, all protocols observed. This was an ambush. I am not in the agenda, but Dr. Mshangi is a very good friend, and he said I needed to speak. My name is Sam Oti. I'm with Canada's International Development Research Center. We are a science funding agency, much like the Wellcome Trust. We've been in Kenya for over 40 years. We were established 50 years ago, 50 plus years ago, by an act of parliament in Canada. And we fund research across a variety of issues, including climate change, health, education, agriculture, and obviously this nexus of climate change and health. I'll be brief. Last month at UNGA, President Trump made these remarks. He said that climate change is the greatest con job ever. He called it a hoax. He said climate change is a hoax. I have a US visa and I don't want it to be canceled, so I'm not going to give my opinion about what I think. But two things stood out for me. That first, the debate on the reality of climate change is here to stay. There are millions of people like President Trump who don't believe that climate change is real. And whether we like it or not, that debate is here to stay. And you might think, well, that's not my problem. In my country, in Kenya, for example, President Ruto believes in climate change. In South Africa, President Ramaphosa believes in climate change. So you might think that you're safe and you don't need to worry. But you look around you, and that can change very quickly. In Brazil, for example, for the longest time, they had presidents who believed in climate change, and then they had President Bolsonaro, who did not believe in climate change and was willing to sacrifice the lungs of the earth, the Amazon, just to prove his point. So my point is that we can't afford to be complacent. It's not a given that your government will always be on your side when it comes to the debate about climate change. And then secondly, science, as important as it is, science is not enough to end the debate about the reality of climate change. We have thousands of publications, IPCC reports, etc., and still here we are, still trying to make the case that climate change is real. And I say this because many of us here are scientists. We were trained at the time when the words of a scientist carries weight, right? You say something, you publish something, and people believe you. But we are no longer in that era. An influencer on TikTok who has 1 million followers has more gravitas than you. People will believe them more than they will believe your publication in the Lancet. So where does that leave us? We're in a dicey situation because whether climate change is real or not, people are dying. The impacts of climate change are happening today. So we don't have the luxury. So what do? This is exactly what we are doing now. We are making moves to translate science into policy. And there are three areas I hope that in the course of this conference that we talk about. The need for data interoperability. Climate and health data is criminal that they are not speaking to each other. We have tons of climate data, we have tons of health data. We need to make sure that they speak together. We need to build the resilience of our health workforce. When I practiced clinically more than 20 years ago, I remember a time when I did surgery without electricity. And I was on a call in a general hospital that served about 150,000 people. I was basically losing my mind, and maybe that's what led me to run away from clinical practice. But what I'm trying to say is that was 20 years ago, and even now, our health workers are being decimated. We have brain drain, they are being underpaid, they are always on strike. We need to build the resilience of our health workforce against the impacts of climate change. And then lastly, we need local, homegrown solutions, nature-based solutions. I see there's a session on that later on today. We need all of that. So I'm so glad that we are here. And then lastly, I think it would be criminal for us to compete against each other. I think this is an opportunity. I know funding is limited, but this is an opportunity for us to collaborate, for us to work together, especially in the context of dwindling resources. And I'm glad that we have people from other sectors coming together. It's time for us to walk the talk on multi-sectoral action. So thank you, and I wish you all a great conference ahead.
Thank you very much, Dr. Sam Oti. That was powerful. So we sincerely thank our gold sponsors, the TNO, the Rockefeller Foundation, the LIPS Kenya, Unit 8, IDRC, Welcome, and many, many other partners, as was alluded to in the morning. And through your support, this has been made possible, and we really appreciate your generous partnership for championing a future where science drives sustainable and healthy communities. Your collaboration also embodies the conference spirit, which, as you have seen, is harnessing science, policy, and partnerships for environmental sustainability and climate health resilience. So, ladies and gentlemen, as I close, we are going now to appreciate all gold sponsors and all sponsors who have made this possible. And this, we are going to do it in a special way. We'll do Karamanda Señorita. And how we are going to take this, we say Karamanda, Karamanda, Señorita, Señorita. That's clear? Okay, let's do it. I appreciate them. Karamanda, Karamanda, Señorita, Señorita. Thank you so much, and back to you, Session Chair.
Thank you very much, Dr. Bundi, for that, and teaching us Karamanda, Señorita. I was wondering what was that, if you're going to make us dance, but thankfully it was just claps. You know, some people have 2 left feet. So thank you very much, and thank you for our sponsors. I think it's very clear from the sponsors and what they've talked about that we all have to work together. It reminds me of SDG number 17 on partnerships for the goals, that without working together, without bringing ourselves in here to hold our hands, to learn from each other and move together, then we are not going to be able to achieve these goals. So it's really good to hear from our sponsors from all over the world, and you know that they are supporting this. There's something that Dr. Dangor spoke about, and I didn't hear a round of applause. It's unfortunate that we didn't have the map, but he said from the map, evidence from Africa is lacking. But for me, what was powerful is that we here can change that, we can shape policy, and Welcome is ready to support this climate and health agenda. And we didn't give him a round of applause. Let's appreciate that, because the ball is in our court. All of us who are here, we have all the support to be able to change that. So hopefully, Dr. Dango, you can hold us to this account. When we have the next conference, there should be evidence from Africa and this part of the world, because the people here have that evidence, they have the capacity to do that, they have the know-how, and they're able to support in bringing that evidence, because without evidence, then you don't know what you're working for, you don't know where your baseline is, you really don't know where you're going to. So I thought that was powerful, and that deserved a round of applause. So thank you for that challenge. Now we'll move on to our next agenda, because we are pressed for time. And this, we want to hear the address on advancing environment, climate change, and health science in the African region. And this session will be hosted by and moderated by the Director General of NEMA, Dr. Mamo B. Mamo. who will also give his opening remarks and chair this session. Karibu sana, Dr. Mamo. Let's give him a round of applause. I know we've been sitting, but let's give him a round of applause and welcome him. Asante.
Thank you very much, Dr. Mercy. Distinguished and other waterborne diseases. If you look at our ambient air quality, we have the challenge of air pollution, particularly in urban areas. contributing to respiratory illness, heart disease, and premature deaths. And when our forests are cleared or ecosystems are degraded, we increase the likelihood of zoonotic diseases, those that spread from animals to humans. And I think we saw this vividly during COVID-19 pandemic. These examples remind us that the health of our planet and the health of people are one and the same. Looking at African context, and my previous speaker has mentioned this, Africa is particularly vulnerable to these challenges, not because we contribute most to global emissions, but because our livelihoods are closely tied to our natural environment. Most of our people depend on agriculture, fisheries, and natural resources, all of which are highly sensitive to climate change and ecosystems. When droughts wipe out crops or livestock, or floods destroy homes, the impact is not only economical, but also physical and mental. Someone mentioned that malnutrition rises and also vector-borne disease spread, and health systems come under immense pressure. We all know, as a continent, the African continent contributes less than 4% of global greenhouse gas emission. Yet, we bear a disproportionate share of the impacts of climate change. This calls for urgent adaptation measures and to integrate environmental and health policies into our national development agenda. But what is the way forward? The way forward is we need to build a resilient nexus so that we'll be able to address and adopt a holistic and multi-sectoral approach. By one, we need a stronger collaboration between environmental agencies, health ministries, climate departments, and also county governments. These institutions must work together. Currently, they are working in silos. Secondly, we must invest in research and data to better understand local linkages, how specific environmental changes are influencing disease trends in our region, so that interventions, as has been said, are evidence-based. Third, we need to prioritize public education and awareness, because citizens need to understand that daily choices have consequences. How we dispose waste, how we use our energy and protect natural resources have a direct bearing on the health of our people and that of the future generation. Fourth, we need, as has been said, a sustainable financing to support long-term environmental health programs. Climate adaptation and public health preparedness require consistent investment, not just ad hoc response to crisis as the case is. And lastly, we must embrace behavioral and attitudinal change. Yes, government can develop policies, programs, but true transformation will only happen when communities take personal responsibility for the environment. Because in NEMA we say, this is our environment, it is our life, and our individual and collective responsibility. And as a regulator, we will continue to lead Kenya's effort in promoting sustainable environmental management initiatives, and we are working closely with health and climate institutions to strengthen environmental governance, enhance pollution control, and build resilience against climate-related health risks. Through environmental education, enforcement of regulations, and coordination of climate actions, we are helping bridge the gap between policy and community action. ensuring that citizens understand that protecting the environment, in essence, is protecting their own health. Colleagues, friends, the nexus between environment, climate change, and health is undeniable. It reminds us that human prosperity depends on the balance of nature. If we destroy our environment, we destroy the very system that sustains us. Our challenge, therefore, is not merely to adapt, but to transform, to shift from reactive measures to a proactive, integrated solutions that secure both human and planetary health. Let this be our shared commitment to build a future where clean air, safe water, stable climates, and healthy ecosystems are not privileges for a few, but rights to be enjoyed by all. Together, through partnership, through science and decisive action, we can turn the challenges of today into the opportunities of sustainable tomorrow. NEMA will be glad to receive and integrate those actionable recommendations from this forum into our ongoing programs and strategies. Together, we can build an Africa that is not only environmentally sustainable, but also resilient in the face of climate and health challenges. I thank you. Now I'll put the heart of the session chair, and I want to take this opportunity to welcome Dr. Jeremiah Mushosho, Africa Regional Team Lead, Climate Change, Health and Environment from World Health Organization, to speak to us on advancing environment, climate change, and health science in the African region. Let's appreciate him. Welcome, Dr. Jeremiah.
Good morning. Good morning. I hope you are doing well. Thank you so much. Distinguished delegates, allow me to ride on the already existing protocol. My name is Dr. Jeremiah Mushosho. I am with the World Health Organization Regional Office for Africa. I'm delighted to be speaking to you today about advancing climate change, health, and environment policy and implementation in the Africa region. Colleagues, as you may have heard, across Africa, families are already living on the front lines of climate change. Rivers and wells are drying up, crops are failing, heat waves are worsening, and when floods come, roads and healthcare facilities are cut off. For our rural communities, the environment, the climate, and their health are one and the same thing. Climate change is not only an environmental issue, but a critical social determinant of health that disproportionately affects vulnerable populations. When a flood washes away topsoil, it also washes away nutrition. When drought dries rivers, it also dries the local clinic's water tank. There's no separate climate change agenda. There's no separate health agenda. There's only one life support system. Africa has always been a land of abundance, rich soils, young people, brilliant ideas, wisdom. Yet we face a paradox where we contribute less than 4% of the global greenhouse gas emissions, yet we bear the heaviest burden: droughts, floods, heat waves, shifting disease patterns. The message is clear. Climate change is not a future risk. It is a present crisis, one that demands policy and implementation that match its urgency. Distinguished guests, policy cannot wait for perfect science. We already know good enough to act. Every flood, every cholera outbreak, every heat wave reminds us that delays cost lives. Imagine the cost of delayed policies. Imagine the cost of delayed implementation. Each year of hesitation means more children without food, more families without water, more preventable deaths. We cannot wait. We cannot wait for perfect consensus. We cannot wait for a perfect deal at the COPs. Every policy we fail to implement, every intervention we delay, every clinic we fail to climate-proof, every system we fail to make climate resilient carries a human cost. The research community here is a powerful window of influence for policy, from embedding health in national adaptation plans and NDCs, using evidence in budget cycles before allocations close, informing urban and agriculture planning for cleaner, healthier cities and food systems, to linking climate forecasts to health early warning systems. And because climate, environment, and health are inseparable, our sectoral policies must also be inseparable. They must speak to each other and be jointly implemented. A transport policy affects air quality. An agriculture policy affects nutrition. An energy policy affects the operational capacity of health systems. Policies rarely impact one sector, and so our responses must be intertwined. The era of isolated policies is over. Integration is the new efficiency and the new morality. At WHO, in the Regional Office for Africa, we are supporting countries to turn global commitments into local action. We are supporting ministries to integrate climate resilience into health policies and plans, access climate finance, and strengthen healthcare infrastructure. The 78th World Health Assembly adopted a global plan of action on climate change, which has 3 action areas. The first one is leadership, coordination, and advocacy. The second one is evidence and monitoring. And the last but not least is country-level action and capacity building. The plan is clear. What matters now is speed and collaboration, as well as courage to deliver. Ladies and gentlemen, to further translate that global action plan, we developed a 10-year regional framework for building climate resilient health systems in the Africa region beginning 2024, which aims to support countries first to strengthen their core national capacities so that the health systems can anticipate, absorb, and adapt to climate shocks. Secondly, integrating climate change into health policies through national adaptation plans, NDCs, national health policies and strategies. And thirdly, accelerating leadership, governance, and resource mobilization. Let us not be ambiguous. Climate change is a health threat. Every rise in temperature is a rise in suffering. Every drought is a hunger emergency. Every flood is a disease outbreak. As you know, health is the face of climate change. That is why the next COP must not be a side conversation. It must be looked through the lens of the health sector. And in a few weeks, the world will gather at the COP, and Africa must speak with one voice. Health must take the center stage. Our entry point is clear. We could propose health as a supplemental agenda which connects all the negotiating tracks to put health at the center. If the next COP is to succeed, it should not only be about carbon, but about people, ladies and gentlemen, to make this reality happen in Africa, let's integrate health and environment into our national development plans. Let's finance renewable energy powered climate resilient health facilities. Let's expand early warning systems and surveillance for heat, malaria, and cholera. Let's empower communities where truly adaptation lives. Implementation is the new diplomacy. Our credibility will come not from what we declare, but from what we actually deliver. Distinguished guests, allow me to close by calling on for commitments for cross-sector collaboration and break down the silos between sectors. Let's commit to the action guided by the Global Action Plan on Climate Change and Health, and also let's commit to justice by making sure that Africa's voice at the next COP is united, urgent, and people-centered. For every African community on the front line of climate change, let us make health the heartbeat of climate ambition. The time is now. The science is good enough to start to act, and the duty is ours. I thank you. Asante sana. Merci beaucoup.
Let's give Dr. Jeremiah another round of applause. Thank you very much. Now we move to the next session. We have two chairmen, the host of this forum, and I want to take this opportunity to invite my chairman, the NEMA Board of Management Chair, Mr. Emilio Mugo. Let's give him a round of applause. Chairman, karibu.
Thank you very much, moderator, sessional chair. Hamjambo tena. Good morning for those who are from outside the East African region. Good morning once more. You know, people are not vibrant. And as a host, I feel a little bit uneasy when people are not very vibrant. Like you've been told, my name is Emilio Mugo, Chair of the National Environment Management Authority. I will ride on the protocols that have already been established, but I want to start by welcoming all those who have come from outside our region to this beautiful country, to this beautiful city, to this hotel which has described itself as the hotel on the fringes of a national park. It doesn't always happen that we have that opportunity. It is a very great honor for me today to stand in front of these distinguished guests, participants, to address you on this, during this very, very great conference, which has been termed as the meeting of the three, what they call giants or elephants, or, you know, in Kenya, the biggest animal is the elephant. So of the giants, and it can never be a better time than now. So on behalf of the Board of Management of the National Environment Management Authority and the management, I extend very warm greetings and best wishes to all the participants at this very important conference. The environment and climate, the two factors that define the health and well-being of people, have undergone significant changes in recent years, largely as a result of anthropogenic human activities. In a report made by the Global Land Outlook in 2022, it reported that a majority of the world's land faces some degree of degradation. And I think those who have spoken before me have shown the nexus between land degradation and health. So land degradation not only reduces carbon sinks, the ability for us to absorb carbon, but also accelerates climate change by increasing the greenhouse gas emissions. And we know the consequences of increasing greenhouse gas in our atmosphere. Further, studies have shown that unhealthy environments increase the risk of disease transmission to humans. I don't want to emphasize that because today I'm seated among one of the biggest group of doctors. So I don't want to contradict myself because the experts are here. But there is that connection that is established, that a degraded environment will result in